Pregnancy is, well, it's an incredible journey. But for so many people, it comes with this nagging, totally unwelcome companion, hip pain, right? It can make the simplest things, like sleeping or even just walking around, a real struggle. But what if there was a way to understand what's going on and, more importantly, find some real relief? Let's dive in.
So, does this sound familiar to you? You're tossing and turning all night long, you just can't find that one comfortable spot, and you wake up feeling like you've run a marathon, not like you've actually rested. It's that deep ache that just kind of casts a shadow over what's supposed to be such a joyful time.
If that's you, the very first thing you need to know is you are so not alone. This is incredibly common. But here's the really important part. Relief is possible. And I'm not just talking about masking the pain. There's a real path to getting to the root cause so you can get back to actually enjoying your pregnancy.
All right, so to find the solution, we first have to really understand the problem. Let's break down why pregnancy, so often, brings on this very specific kind of pain. I mean, it's no secret your body goes through a monumental transformation during pregnancy, and your hips, they are right at the center of all these amazing changes. Okay, so a key player in all of this is a hormone called Relaxin. Its job is pretty incredible. It literally relaxes and loosens the ligaments all around your pelvis to get your body ready for birth. Now, while this is absolutely essential, that loosening effect, well, it can also lead to some instability in your pelvic area. And that sets off a kind of chain reaction. So first, relaxin makes the pelvis less stable. At the exact same time, your growing belly is shifting your center of gravity forward. This puts all this extra strain on your lower back and hip joints as they try to pick up the slack. This combination of instability and strain, it's just the perfect recipe for pain.
Okay, now let's get into why this pain often feels so much worse at one particular time, at night.
It's such a frustrating paradox, isn't it? You lie down to rest, hoping to get some relief, but instead, the aching just gets more intense. So what is actually going on here?
Well, you know how everyone recommends side sleeping for good circulation? They're right. But it also puts direct, constant pressure on your hip joint. Then you add the baby's weight to that, and the strain just goes up. But here's the real kicker. If your pelvis or spine is already a little bit misaligned from all those changes we just talked about, that pressure isn't spread out evenly. It gets concentrated, creating a single hot spot of pain right when you're trying to sleep.
Okay, enough about the problem. Let's actually talk about the solution. And there's really a two-part approach to finding real, lasting relief.
And you can start feeling a bit better right now, at home. These aren't just little tricks. They're genuine ways to support your changing body. You know, putting a pillow between your knees? That helps keep your hips properly aligned while you sleep. A warm bath can soothe those overworked muscles, and gentle stretches just feel good and help you move better. These are all fantastic starting points.
And this really shows us the difference between two main approaches. Things like pillows and warm baths are great for managing symptoms. They definitely help you feel better in the moment, but they don't fix the underlying structural issue that's causing the pain in the first place. To do that, you've got to address the root cause, that misalignment in the pelvis and spine. And that is exactly where prenatal chiropractic care comes in.
So, let's unpack how this gentle, very targeted approach works to give you not just temporary comfort, but actual, lasting relief from that pregnancy hip pain.
So the first thing to know is that we are not talking about any kind of forceful movements here. Prenatal chiropractic adjustments are specifically designed for the pregnant body. They're soft, regulated techniques, and the whole goal is just to gently take the pressure off your joints and nerves. There's no squeezing or painful bending involved at all.
And the benefits are aimed directly at the problems we've been talking about. An adjustment helps rebalance your pelvis so it can support your body's weight way more effectively. And what happens then? Well, it relaxes those overworked muscles. It improves your joint mobility, and it helps correct your posture, which makes everything from walking to just standing up feel easier.
And the biggest results of all this, for so many women, it's finally getting a good night's sleep. By relieving that concentrated pressure and restoring balance, you can actually find a comfortable position and wake up feeling rested, not sore. And let's be honest, in the third trimester, that feels like an absolute superpower.
You know, this really gets to the heart of it all. This journey is supposed to be a marvelous experience. It shouldn't be defined by just gritting your teeth and enduring constant pain. There are safe, effective ways to support your body so you can focus on all the joy of it.
Ultimately, this journey is yours. So the final thought we want to leave you with is this.
If hip pain is getting in the way of your experience, are you ready to look beyond just the symptoms, address the root cause, and reclaim a more comfortable, joyful pregnancy?